Ring ring. Is this Dr. Sim? Hi there, this is Lindsay. I'm the nurse taking care of Katie Mills, the 2-day-old female patient on the Sim Suite floor at BYUI Hospital in room number 1. I'm calling today because I think that we are having some signs of some impaired gas exchange that might be related to a cardiac defect. So the vitals, she had a heart rate of 164, a respiratory rate of 60, blood pressure of 78/48, and her oxygen was at 89% on room air. She's been fussy, she cries easily. On auscultation, I heard a grade 4 systolic murmur, and her 4-point blood pressures were irregular with about a 4-point difference within those. She's also exhibiting nasal flaring, moderate intercostal retractions, and she's got crackles in the lower left lung borders. She sweats and tires easily during breastfeeding and even though they're trying to feed her every 2 hours, and she's also had decreased diaper wetting and her skin is pale. And she was born 2 days ago. So, yeah, I think that they have her scheduled for an echocardiogram to check for a ventricular septal defect, and they're going to watch for that. As for right now, to treat the heart defect in the meantime, I think we should go ahead and do some Lasix to decrease the fluid volume, and then also give her some oxygen to improve her oxygen saturation since it was at 89%. And then I think we could also maybe go for doing like an inotrope like digoxin to also help her heart contraction that way. Okay, and then an example of orders I could read back. Okay, I'm going to administer 8 milligrams of Lasix IV push stat. I'm going to administer 30% oxygen via nasal cannula. I'm going to administer IV D5 with 1/3 NS at 20 mils an hour. I'll need to start an IV for that. And then I'll also administer digoxin PO in a liquid suspension, 220 micrograms in the loading dose, and then 3 divided doses over 24 hours of 35 micrograms every day. And then we'll continue to monitor with strict eyes and nose and daily weights. And then I will call back tomorrow if we don't see an improvement. And I will also call back with the results from the echocardiogram. Thanks, Doc.